And let me start off by thanking everybody for attending our NYC H&H and Elmhurst Black History Month event. And we're going to start off this afternoon by hearing from none other than Regina Wilson, who's had such a distinguished career at the FDNY for 22 years. She's the past president of the Vulcan Society, as well as the United Women's Firefighters Association. Want to welcome her and in her beautiful voice as I know it. Take it away, Regina.
Lift every voice and sing till earth and heaven rings with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling seas. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the presence has brought us. Facing the rising sun of a new day begun. Let us march on till victory is won. Stony the road we trod, bitter the chastening rod, felt in the days when hope unborn has died, yet with the steady beat, paths now weary feet come to a place for which our fathers sighed. We have come over a way that with tears have been watered. We have come treading our path through the blood of the slaughter. Out from the gloomy past till now we stand at last, where the white gleam of our bright star is cast. God of our wearies, God of our silent tears, thou who has brought us thus far on the way, thou who has by thy might led us unto the light, keep us forever in the path we pray. Lest our feet stray from the places, our God, where we met thee. Lest our hearts, drunk with the wine of the world, we forget thee. Shadowed beneath thy hand, may we forever stand, true to our God, true to our native land.
Woo. All righty. It is my pleasure now to turn this over to our new CEO of Elmhurst Hospital, none other than someone who's committed her life to public service and has been someone who's been in the community and knows the community and is of the community. I'm so proud to have her serving in her capacity during this complicated time for our borough. But we know that she's, through this period of darkness, she's going to be one that brings a lot of sunlight as we come through this pandemic. None other than Helen Arteaga. Thank you so much. Great to see you.
Good afternoon, everyone. Thank you so much for this great honor and me kicking off this great event. Queensborough President Donovan, you know, I'm so happy to be starting this journey with you. We're like two kids from the old block, you know, making big changes in our beloved borough. So I wouldn't want anyone else to have this adventure with other than you. So I'm super excited to be starting both this journey together. But again, happy Black History Month. What a great way to remember our civic movement and how much we've accomplished and how much we have to go forward. Again, my name is Helen Arteaga. I'm the new CEO of New York City Health and Hospital Elmhurst. We're actually one of two hospitals here in Queens. We actually have our sister hospital in Queens, who in this beloved borough. We're working very hard to ensure everyone in our community that's seeking healthcare gets the most amazing healthcare they can get through our walls. So please come visit us. And we're here for you guys. I want to give a special thank you again to the borough president, City Council member Adams, NYSA, and Metro Plus for sponsoring this beautiful event. And more important, this important event to make sure that we always remember where we're coming from and where we need to go. The hospital looks forward to doing more of these education and outreach events in the coming weeks to educate our community about COVID-19, our vaccination goals, and help our patients and our families come back and getting the healthcare that they need. I want to take this opportunity to encourage everyone to continue getting healthcare. It's super important. Make sure you get vaccinated. If you have any questions, we have amazing speakers today that are going to help you get more education and understand where we are in our healthcare status today. Now it's my greatest pleasure to introduce you our moderator and our MC for today, no other than one of our amazing nurses, Ms. Karen Lockwood. Karen is our director of our Women's and Children Division of Nursing here at Health and Hospital at Elmhurst. She's also a member of the American Nurse Association, the Association of Women's Health, OBGYN nurses, and a member of Six Sigma through International Honor Society of Nursing. And plus so many other things it's not even on this list. Karen is amazing. So I'm honored to be sharing this stage with you. Karen, take it away.
Thank you so much, Helen, for your introduction. And again, we welcome and look forward to working with you here at Elmhurst. Good afternoon, everyone. Thank you for joining this special Elmhurst Black History program. I want to give special thanks again to the Borough President, Donovan Richards, the New York City Council member, Adrian Adams, NYSNA, and Metro Plus for sponsoring the program today. We will now have some brief opening remarks from our elected officials and sponsoring organizations before we jump into our wonderful panel discussion. I would like to first introduce our newly elected Borough President, Donovan Richards. He was a great supporter of our healthcare facility when he represented Southeast Queens in the New York City Council. And we look forward to working with him in his new role, Mr. Borough President.
Thank you so much, Karen. And once again, so great to see Helen. Want to thank the Elmhurst family, Elmhurst Strong family, because you have been through one of the most difficult times, I think, in our city's and country's history, but you all continue to shine so brightly and to serve your community. And of course, to my sister, I think I said Adrian Adams, hello. And to all the nurses and doctors and administrators and workers at Elmhurst, thank you. And to the community, most importantly. And I would be remiss if I did not. And of course, to my auntie, I call her Claire, who's known me from when I was a little boy, and she's been committed to this institution for a long time. And that's why I could sit up straight in this chair and be the BP, because I had people like her on my case. The other thing I'll say is I always remember my good friend, and I talk about her all the time, Priscilla Carroll. She is someone who was with me at the beginning of my journey in politics into the city council, and I miss her daily, love her, and we're going to continue to do the work that she started. As you know, the pandemic was a devastating moment in our borough's history, So I just want to start by stressing the four things we always stress: stay at home if you're sick, wear a mask, practice good hygiene, and wash your hands. And of course, social distance from others outside of your home by staying at least 6 feet apart. My office has been on the front lines along with my colleagues, making sure that we distribute PPE. To date, we've distributed about 30,000 masks, thanks to the mayor's office and governor's office, and additional donations, and of course, hand sanitizer. And we know that testing is a key component in the battle against COVID-19. So it is very important, and we want to continue to stress our community members to get tested. I get tested, we get tested here. Get tested, it's very important. Many are now conscious about testing and taking protective measures against infection. However, it is important that we continue to push for the implementation of more testing sites. We did that along with my colleague, Adrian Adams, just a few weeks ago in Richmond Hill, where we saw double digits of positivity rates, and very thankful to the mayor and the governor for responding to us. So we're continuing to push on that front. We also have offered testing twice in conjunction with the Health and Hospitals Corporation, who I want to say has been a steadfast partner through this as well at Borough Hall. And I'm going to just jump into just a few other points before I turn it over to Adrian. I want to start by once again, and I think our president alluded to this and Karen alluded to this as well, please get your vaccine. And I know that we have a history as Black and brown folks with experimentation. We think back to the Tuskegee experiment in our communities. So we know that there's a history here, but this vaccine is not experimentation. It's about making sure that our families, that our communities, that our city can get back to some semblance of normalcy. I know I of course was not going to jump the line, but as soon as that vaccine is available, I'm going to go and take it. I have someone here on staff, a police officer assigned to me. She's taken the vaccine because she was prioritized. I visited many institutions as well across the borough where people have received the vaccination who look like me, and they're still walking, they're still talking, they're doing all right. So don't hesitate to get the vaccine when it becomes available. And just on some other fronts, one of the things we're fighting is to make sure that you don't have to leave your community to get the vaccine at all. We believe that you should not have to travel necessarily to Citi Field. Although Citi Field is great and it was a home run for the borough, we want to see many of our community-based organizations, our hospitals, our institutions that are trusted in our communities, our houses of worship, being a part of this solution. So we look forward to continuing to work with H&H as the vaccine ramps up, especially because we know the Biden administration has hinted that they anticipate that we should see a large tranche of vaccines coming into the city and state come July. I think he's ordered upwards of 600 million doses of this vaccine, which means that it should and could be available to everyone in our communities. So I want to urge you to do that. And this is why we're hosting this event, of course, in honor of Black History Month. We celebrate our heritage, we celebrate our history, we celebrate where we came from and where we need to go. And we know that there are a lot of inequities that we still have to address as a society when it comes to housing and food insecurity and jobs and good jobs. All of those things are front and central, but more importantly, healthcare is critical. So you're going to hear us talking a lot about the need to make sure we're investing in institutions like Elmhurst Hospital and seeing more hospitals being built across Queens and seeing more H&H clinics and seeing more quality care, which is essential for us getting back to not where we were, but moving into a better future for our community. So I want to thank you, Karen, and thank my Elmhurst family, because y'all have become family. I was in the South, South Side Queens. We only had Jamaica and Far Rock in St. John's Hospital, but I have really felt such a connection to the people of this hospital, to the staff, and most importantly, to all of our Queens community who lives here and serves here. So thank you so much for having me. I look forward to hearing the panel, and I hope everybody gets good information today. And your job is to be the ambassador once you get this information, to take this information and to spread it and to let people know that they should take the vaccine. So God bless you all. Thank you. Good to see you all.
Thank you, Mr. Borough President, for those wonderful comments. Our next speaker is Councilmember Adrian Adams. She represents City Council District 28, which covers the Queens neighborhoods of Jamaica, Rochdale Village, Richmond Hills, and South Ozone Park. She is also Vice Co-Chair of the Council's Black, Latino, and Asian Caucus. We are so proud of Adrian Adams because in addition to being one of our elected representatives, she was also born at Elmhurst. Way to go. Council Member Adams, your comments, please. Thank you.
Thank you so much, Karen. It is a pleasure to be here with my Elmhurst Hospital family. Congratulations, Helen. Rooting for you. Glad you're there in that seat. Goodness knows we need you right there. And absolutely 100%, I am a baby, literally, of Elmhurst back in the day, Elmhurst General, who you are now, Elmhurst Hospital. I wear that proudly as one who was born in East Elmhurst, Queens. So I'm just so happy to be here with my Elmhurst family. You know, it seems like just yesterday we were sitting in the auditorium. I believe it was just about a year ago before this pandemic actually hit where we were in the auditorium celebrating Black History Month. And I was one of the speakers. There was a talent show, and it was absolutely amazing what went on in that auditorium that afternoon. So where we are not able to physically be with each other this year, we certainly are at a virtual space that needed to be done. COVID-19 and the Black family. You know, my brother and colleague, Queensborough President Richard said it very well. This pandemic really has hit us hard in communities of color. We've never seen anything like this. And it's been very difficult. I lost my father almost a year ago because of complications due to COVID-19. And we didn't even know that he had the virus. It masqueraded on him as symptoms of his congestive heart failure condition. And that's what we thought that we were admitting him for. And it turns out that he tested positive for COVID-19. Subsequent to that, 2 months later, he had tested negative a few times. We were ready to actually bring him out and take him into nursing care facilities, and he passed away before we could even get him there. So this is personal to me. Participating in forums like this is very personal to me. I take it very seriously. And again, I echo the sentiments of my colleague and brother in just saying that we are doing still everything that we can to make sure that testing is available in our districts. It's been very difficult and it's been a struggle. I do represent portions of Richmond Hill who have been hit very hard with this spike over the past few months, and we have done everything that we can to make sure that testing is available for them. As we look now at vaccine access, there may be some trepidation in the Black and Brown community for taking the vaccine. That is valid. However, we do not want to compound death upon death. The vaccine is a lifesaver. And as one who has just become available, I guess, I'm in the category now as having pre-existing condition. So I'm in the category now to get that vaccine. I will be getting my vaccine on Saturday. And I will be getting that vaccine with a smile on my face. So I say to all who are watching us today, those who share my complexion, please get vaccinated when it's offered to you. I never thought that I would consider hypertension as something to look forward to. But imagine that in this upside down, topsy-turvy world, I am actually able to take the vaccine because of that pre-existing condition. So I encourage you, take the vaccine. We have people of color who are in the science who created this technology for this vaccine for us to live. I encourage all of you, let's live. Thank you again, Elmhurst Hospital, for hosting us today. I look forward to learning from you as I look forward to being in your company. Thank you so much.
Thank you, Council Member Adams, and thank you for sharing that story with us today. Our next speaker is Judith Cutchin, RN, President of New York State Nurses Association, Mayoral Executive Council, representing more than 8,500 public sector nurses throughout New York City. She has been a registered nurse for over 30 years and currently serves as a head nurse in the Ambulatory Specialties Clinic at Woodhull Hospital. Judith, your
Hi,
comment.
everyone. I'm excited for being here with my Elmhurst family, where I am also a patient. So the New York State Nurses Association and the doctors and all other healthcare workers, we came to work every day, knowing fully well that the deadly virus was there. We worked alongside each other in the public system to give the patients the care that they needed and deserved, and we saved thousands of lives. However, we must be reminded that the battle with COVID-19 is not over. It still goes on. And it is in the spirit of giving our all and continuing effort that we endorse to participate in the vaccine program underway at all New York City Health and Hospital facilities and in the communities. The vaccine is essential to protect nurses like me who have had my vaccine, the doctors, the patients, healthcare workers, and community who we all care for. The COVID-19 vaccine is a part of the roadmap that's going to take us back to a safe place where we can once again participate fully in our communities without any fear. And let us work together to keep our patients and our communities safe. Please, this is an urgent call. When it's time to be vaccinated, to get vaccinated, continue to be tested. Let's work together to keep our communities safe. Thank you.
Thank you, Judith, for those words. As a fellow RN, I echo those words as well. I'm a Vax champ. I did get my vaccine and I'm so far doing fine. So thank you again. Our last speaker before we jump into our panel is Roger Milner, Chief of Growth Officer for Metro Plus. In his role at Metro Plus Health Plan, one of New York's largest health insurers, he promotes affordable healthcare options to New York City residents and works diligently to foster strong community partnership. Roger?
Good afternoon, everyone. And first, I'd like to say what an honor it is for Metro Plus to be a part of this wonderful panel. I'd also like to welcome our new CEO, Helen, who is now taking over the helm of Elmhurst Hospital. Metro Plus is more than just a sponsor of today's panel. We are a true partner with Elmhurst Hospital and the New York City Health and Hospital Corporation. I'd just like to start off by saying a little quote: "Do the best you can until you know better. Then when you know better, do better," by Maya Angelou. Since 1985, Metro Plus Health Plan has built a reputation for providing access to affordable, quality healthcare to the people of New York City. We are a wholly owned subsidiary of the New York City Health and Hospital, which is the largest municipal health system in the United States. Metro Plus is the award-winning plan of choice for over 600,000 New Yorkers. As Metro Plus has grown, so has our commitment to offering medical, psychological, and well-being services. We're all about diversity of care. We offer dozens of comprehensive health plans, such as Medicaid managed care, Medicare, and many other affordable products. No matter who you are, no matter how old you are, no matter what you need, we have a plan for you. Geographic diversity. Our network spans over 30,000 providers across the 5 boroughs: primary care doctors, specialists, behavioral health, and OBGYN providers, to say the least. Diversity of service. We have a strong focus on primary and preventive care and a robust network of doctors. Staff diversity. When it comes to our members, we're constantly on call. You can always contact us via our website or calling our 800 number. We speak over 13 languages at the service center, and we have an interpreter service center that ultimately will help us be culturally sensitive and be able to speak in over 40 different tongues. So we all know some of the facts that Black and Latinx New Yorkers are twice as likely as whites to die from the coronavirus. 22% of low-income New Yorkers who lost employment income in their households was due to the coronavirus. And they said that they lacked health insurance during this time of the pandemic. 39% of Queens residents did not have health coverage through their employer or their union, as compared to the less fortunate in Manhattan. So just to say a few words about Metro Plus in the Black community, Metro Plus served 11,859 African-American members during the COVID-19 pandemic over the age of 18. Our total African-American membership expands over 156,000 members. So during the coronavirus, MetroPlus teamed up with Amwell to create what we call the virtual visit telehealth adoption. In March 2020, New York City emerged as the epicenter of the COVID-19 pandemic. In late March, we partnered with Amwell to create this virtual visit. Telehealth provided immediate care for our members who had to self-quarantine and practice social distancing. MetroPlus worked with Amwell on a multi-channel approach that included emails, direct mailers, interactive voice responses known as IVR, and short messages through SMS texts. In April 2020, Amwell engaged service team began to send out these emails and direct mailers to this campaign of the MetroPlus members who were affected by the coronavirus. Emails and direct mailers emphasized things like step-by-step instructions on how to use telehealth. We helped answer most of the frequent questions that they had. We provided 24-hour access to board-certified doctors and availability of online prescriptions. So what were some of the results of what we did? We actually served over 7,000 members through telehealth visits in less than 3 months. 41% were insured by MetroPlus's Medicaid program. We provided urgent care through therapy and psychiatric visits, to say the least. So in part, MetroPlus is more than just a health plan. We're a true partner with Elmhurst to serve the African-American community, and we thank you so much for allowing us to be a part of this wonderful panel.
Thank you, Roger, and thank you to MetroPlus for all you do to provide service to our community. And now I'd like to introduce our panel for the afternoon. Each of them are very accomplished in healthcare field and will bring unique perspectives to our discussion today. Our first panelist, Dr. Marlon Brewer, is currently the Chief Physician of Elmhurst Hospital's Medical Primary Care Clinic and the Associate Director of Department of Ambulatory Care. He is also an Assistant Professor of Medicine at the Icahn School of Medicine at Mount Sinai. Our second panelist, Dr. Phillip Fairweather, is currently Associate Director of Elmhurst Hospitals Emergency Department and an Assistant Clinical Professor of the Emergency Medicine at the Icahn School of Medicine at Mount Sinai. He is also the Medical Director of Elmhurst Urgent Care Clinic, known as Express Care. Our third panelist, Mr. Gregorio Mellott, MPH, is a well-published and nationally recognized epidemiologist, researcher with a significant experience working at the highest levels of the federal HIV policy and development at both the White House and the Centers for Disease Control and Prevention, the CDC. He currently serves as Vice President and Director of Public Policy for AmFair, an international nonprofit organization dedicated to the support of AIDS research and HIV prevention. And last but certainly not least, Ms. Renee Mills, LMHC, is a mental health counselor and assistant director in Elmhurst Hospital's Behavioral Health Clubhouse program. She provides assistance and encouragement to adults diagnosed with mental illness who are transitioning back to their communities. And now with that, we'll get on with our discussion. We will do our best to leave time for questions before the program ends. I'd like to start with you, Dr. Fairweather. Being a doctor in the emergency room, you were at the epicenter and the start of everything here at Elmhurst Hospital Center. And again, thank you for all that you do here. Can you talk a little bit about your experience during COVID and what it was like for you on a personal level and as an African-American who works in the healthcare field?
Well, good afternoon, and thank you for this invitation. And I think this is very, inspiring and great to hear us speaking with one voice about the importance of this, communicating to our community the need for vaccinations, and really this is the moment. Vaccination is really kind of is the holy grail, the thing that we most looked forward to back in the dark days of the early, late winter, early spring. I frankly will say that probably the words that most represent the way that I felt around, the height of the pandemic, the first surge, was truly frightened and really devastating. That's what we were really up against. As an emergency medicine doctor, we were basically sort of like on the shore, and the tsunami hit us, and we sort of felt that first surge. And it was really the beginning that, you know, it wasn't something that we'd ever kind of, at least certainly not for me, contemplated having to manage, to deal with. You know, we were prepared as an emergency department to deal with, you know, massive influxes potentially of patients who were mass casualty events. But never have we really thought, or certainly not I, that, you know, we would be sort of in the midst of the pandemic. And Elmhurst really was hit quite hard. And I must say, though, that we've got an incredible group of people, both in the emergency department and the rest of the hospital, that did an exceptional job at, you know, getting us through that time. I think the reality for us was that during, you know, the earliest parts of this time, we saw what was happening in Europe. We couldn't have imagined that coming here. But little did we know, Elmhurst, the community, you know, really had a lot of the ingredients of what made this pandemic, you know, flourish. It is an infection that is respiratorily transmitted. This is a community, Elmhurst is in a community of people who live in close quarters with multiple generations under the same roof. There isn't as easy the ability to socially distance. You know, we take public transportation, and, you know, let's face it, frankly, we got a lot of mixed information or false information early on, and we really didn't get a unified voice, especially among our, you know, from Washington. And, you know, these are, in this community, are people with illnesses or comorbidities that really put them at highest risk for infection, for bad outcomes. Diabetes, hypertension was mentioned, obesity. Again, all of these things, you know, immune compromising illnesses, these were all things that really put us at risk and made us sort of, you know, feel the surge and we're so badly sort of, you know, affected early on in this pandemic.
Thank you so much, Dr. Fairweather, for those comments. For our next question, Dr. Brewer, we recently heard Dr. Fairweather mention all of the challenges of the community that they faced, living in close quarters, having comorbidities. What are some things that people can and should do to keep themselves and their families safe while we wait for the vaccine to roll out? We've heard from our new president. He's trying his best to ramp up the production of vaccines and getting it in everyone's arms who actually needs and deserves this vaccine. But what can we tell our listeners and our community to do really right now to keep themselves and their families safe until they have the vaccine available to them? Dr. Brewer, please unmute.
Oh, there we go.
Thank you.
The two different unmute signs.
Thank you.
Thank you for having me this afternoon. It's really an honor to be here. Clearly, I mean, the basic stuff, right? Stay at home if you don't have to leave home. Wear your mask, socially distance, hand hygiene. But clearly we're here and we have, if you need to come to the hospital because you're sick, we're here for you and we have a safe environment. We have done everything to make our clinics safe. We don't want people with chronic disease to become uncontrolled, right? I believe that, you know, so people have to use the sense if you're sick and you should be in isolation, you should be in isolation. One of the things that we learned during COVID, because we had a lot of telemedicine, was how important the social determinants of health are. Because we found tons of patients, like Dr. Fairweather said, that were essential workers. They couldn't miss, they had to be in person at work. So that put them more at risk for being infected. They weren't getting sick pay if they didn't show up. They had tight quarters at home. Luckily, we have that, you know, the city hotel program that we could refer some of our patients to, because we really did find that we had a lot of patients that had necessities that we could help with. But for right now, the basics. We're going to have the mask for a long time. And we need to use them. And right now, our department is, even during COVID, we were in charge of, a lot of testing. We lost some of our staff to cover the inpatient setting because they were redeployed, but we did community testing, employee testing. We supported the occupational health service because not only were our patients getting sick, but our employees were getting sick. And now we are tuned in to vaccination. We need to vaccinate, and vaccinate everybody that's eligible, the whole community.
Thank you, Dr. Brewer, for those comments. Mr. Gregorio Mellott, you've heard Dr. Brewer's comments about vaccination and the importance of vaccinating, especially if you have some comorbidities. And I know in your work, you deal with people that may be HIV positive, then have AIDS, and some of these populations are skeptical because of these comorbidities with actually receiving the vaccine. What would you say to someone about their vaccine? Why it's important for them to actually consider and to take the vaccine?
So thank you again for having me. I think that this is a wonderful discussion, and it's great to see fellow New Yorkers after living in Washington, D.C. for so long and being born and raised in New York. I think that there's a reason why there are so many people in HIV, particularly HIV researchers like myself, have been so involved with COVID-19, is because we've seen this all before. We've seen this before in terms of an infectious disease, primarily affecting communities of color, where there is a lot of mistrust in terms of medications, where we see that when the medications are available, our communities are last to have access to those medications, just like we see with COVID testing, as well as with the rollout of the vaccines. And we understand that there is a lot of mistrust because of that. I think in terms of trying to address some of the mistrust and some of what we see as well with some people living with HIV, is that working with providers that people already trust and messaging from providers that people already trust is incredibly important. In the HIV space, there are community-based organizations that are really trusted by members of the community for HIV, and they've also been central with the COVID response, making sure that providers, such as the providers that we have on, particularly from communities of color, are also trusted voices to help people understand what the issues are with the vaccine and to move forward with it. I also think too that people who are at first distrustful of the vaccine, such as what we've heard from many of our historically Black college and university presidents, people who are at first distrustful of the vaccine, but then turn around and say, well, maybe this is something that I've seen, implemented, I can trust it now, I'd like to move forward. That's also remarkably effective in getting people to think about and trust the vaccines. But the one thing that I would like to add is that, even though HIV is a comorbidity, comorbidities is not what's driving this pandemic in communities of color. It's exactly what we've seen with HIV. We've seen it with other diseases as well. My colleagues and I published a study that made a lot of news last year. It was the first large national study to take a look at COVID-19 in Black communities. And what we found is that, diabetes, heart disease, HIV, or cerebrovascular disease in counties that are disproportionately Black was not driving COVID-19 in Black communities. What was driving it was percent of people who are unemployed, percent of people who are uninsured, percent of people who lived in households where there were high occupancies. So it's, again, dealing with these social determinants of health that our country has really never reckoned with in a good way to understand how that drives healthcare inequities. Even the National Academy of Sciences says that healthcare inequities are only 20% driven by healthcare and 50% driven by social determinants such as income, residential segregation, language differences, and many other social determinants. So hopefully this is going to be a reckoning for our country to really start looking at how these social determinants disadvantage some communities and think about ways that we could actually eradicate the social determinants so we don't have to face another pandemic for HIV or COVID-19 in the future that disproportionately impacts African-American communities.
Thank you so much for those comments. Just to piggyback about the health inequities for Ms. Mills, as we look at the COVID pandemic and who's been exposed and how it's made brought to light all these health inequities to our communities. And as we try to move past into the future post-COVID, what are some of the things we can do for our communities to remain safe and healthy. I want to mention mental health because I know that's also your field, and that's very important to address too. There's a lot of anxiety and stigma related with COVID and even going for a COVID vaccine or a COVID testing. How would you let our community know that we can move forth with the testing and with the vaccines, and also ensure that we begin to look at ourselves wholly with our mind, body, and soul, especially our mental health? How do we address those issues?
Good afternoon. I just wanted to mention that the views I'm expressing here are mine, and they don't have anything to do with the work that's being done in the behavioral health department. What's important is bringing the information down to the level where people can be receptive of it. Right now, there's a lot of media information going on. There is some stuff about vaccine effectiveness. Some of the information is good, some of the information is not. People need to be looking at reliable sources. Also, I agree with Borough President Richards in that more ambassadors need to be out in the community promoting the vaccine. I've had the Moderna vaccine. I've had my second vaccine at the beginning of February. I wasn't sure I was going to get it at first, but I work in an enclosed environment, and I thought it was important that we should all be vaccinated if the vaccine was available to us. It has become available. And now what I'm doing is I'm going out to my community. Unfortunately, I don't live in Queens. I travel on the subway. I travel on the bus to get to work. I'm telling people as I travel and come in how important the vaccine is. I'm telling my neighbors how important the vaccine is. What's going to be difficult is getting the vaccine out to the mental health community, because they're already intimidated by the medication they already have to take. And if you're telling them to take a vaccine and they're not getting proper information about how effective it is, how important it is for them to take it. Also, if they're heavy into their mental illness, it's hard to explain to someone with schizophrenia that they need to take a vaccine and how important that vaccine is. So I think that we need to, in addition to going to houses of worship, in addition to going to food banks and soup kitchens and all of those places where our Black people are, and they need our help and they need our assistance and they need our knowledge, we need to be going to supportive housing places. We need to be going to mental health programs. We need to be letting people know, as many people know as possible, how important it is to get that COVID vaccine. We're going to still have to wear the mask for a little while, and that's okay. I think in New York, we do that very well. I've seen other places. I've talked to my brother in Georgia. They don't. We do that very well here. We are masked up. I must say that. But we need to have a mental health idea when we're talking to people, because everyone is not receptive to the information. All of our Black community is not going to go get a vaccine right away. Now we're worried about this new strain, and people have even come to me. They need to know what the ingredients are in the vaccine. I had someone ask me the other day, is the vaccine a dead COVID virus? And I had to explain to them about the mRNA. So it's kind of difficult. It's kind of hard. You need to be explaining to them at the ground level.
Thank you so much for those comments. Dr. Brewer, having listened to Ms. Mills' comments, and you working in ambulatory care and you see your patients, what would be the best way to try to explain to them if they had questions about the variant and the strains, and to maybe ease their fears a little bit about the vaccine during a visit with one of your patients?
Well, I think the vaccine is really the only arm that we have against these variants, because the variants mutate when people get infected. So if less people get infected, more people vaccinate, we'll have less problems with the variant. So, and I mean, you have to explain, a lot of people do think, like Ms. Mills said, that, you know, you're injecting them with either a weakened or a dead virus, and you have to, you know, explain on a level what the, you know, messenger RNA technology is, that it's been around for a long time, that the vaccines are safe and efficacious, and that you got the vaccine. I think we have to lead by example, okay? And that, you know, and that I even explained to them, listen, in my house, because they want to know which one's better, which one isn't. You know, in my house, there are 6 of us, 3 of us got the Pfizer, 3 of us got the Moderna, we're all fine. We had minimal side effects, you know, and this is not only with the patients, this is also with, you know, our staff. And like I said, we do have to lead by example. It doesn't serve for us to get 5 out of 10 people a vaccine. We need to have a critical mass. We need to have herd immunity. So we need a minimum of 7 people out of 10 to get the vaccine. And if people really want to be able to have some sort of normal life, do the things that they want to do, that they were doing before, that they can't do now, we all need to get the vaccine, although we have to maintain social distancing. But if you want to go to that ball game, or if you want to, you know, be able to go shopping, you want to see your family and friends, we all need to get the vaccine. It's not just 1 or 2 or 5 of us. It's a lot of people need to get it. And we don't want to have to go visit our patients in the hospital because they're sick with COVID. We rather see them in the clinic. And to continue a normal life, or as much normal as we can, we need to all get the vaccine.
Dr.
I
Brewer,
don't think we can overstate the value of the one-on-one conversations that we have. And I have to just share that the idea, you know, the importance of us who've been vaccinated and who are, you know, understand this technology, to really speak about it and to invite people to talk about their concerns. There are lots of myths out there. The internet, social media is, you know, ripe with just information that is just so off the mark and so destructive that really there's multiple areas, multiple venues that we really have to focus on. But I think, you know, I can't tell you how many times I've had someone pull me aside and you know, one of the people in the hospital just pull me aside and say, you know, give me the deal here about this vaccine. And that conversation was enough to help them make that decision. So I think we need to do more of that as one-on-one is really key to the success here.
Dr. Fairweather or Brewer, I have a question in the chat room. Is the vaccine safe to take if you're pregnant or breastfeeding?
None of the studies included pregnant women or breastfeeding women, but the ACOG, the American Association of Obstetrics and Gynecology, sees no reason why it wouldn't be safe, although they recommend speaking to your obstetrician or gynecologist about it. But clearly we'll know more information as this go along, but ACOG has said that as their statement. So I have had patients ask me, and I've recommended that they get their vaccine. Pregnant women are a lot more, it's much more possible that they'll have bad outcomes with COVID. They end up, you know, hospitalization is more, ICU visits are more. So it's a risk benefit thing. So if that's their risk, then the vaccine is the benefit, right?
Claire, do we have any more questions in the chat? We're opening it up for questions at this time.
Not at the moment. Karen, thank you.
If there are no questions.
They're coming in as we speak right now.
Thank you. Just to speak to Dr. Brewer's point, because obstetrics actually is my specialty. We have seen women unfortunately come in with COVID, and some of them did well, and we've had a few that did not do as well, but did recover. So again, as you said, it's important to speak with your provider. Pregnant women see their providers often, especially as they approach their delivery date. So they have ample opportunity, as was spoken about, to build those connections with your provider, to feel comfortable, to have those conversations, and to bring those things up at their visit so they can make the best choice for themselves during their pregnancy. Claire, any other questions? If
Okay,
not,
I do have a few. How are we doing with educating folks in ethnic communities where skepticism about vaccines still exists?
if I may just speak about that, Claire. Each Sunday, I'm on live with my house of worship, giving them a COVID update. And part of that update is informing the congregants about our rates where I live, where the vaccine sites have opened up, how to make appointments, sharing my own story, letting them know the importance of social distancing, wearing masks, and all those things. I think, we have to reach out to the public almost in a grassroots type of way to inform them and to do it in a manner which they feel comfortable. You can't be so strong-armed with them or give them information that they can't understand. So for my church and our congregation, I think that that's been helpful for them to open up and ask questions and be more open to take the vaccine.
Great, thank you. Here's another good question. Please discuss the risks associated with patients who have a history of anaphylaxis. Dr. Fairweather or Brewer, you want to take that one, or Giorgio?
I think that, this is an area that a conversation I think would be best had with if a person has a history of, highly allergic responses to medications or to, any sort of allergen. I think that the safest conversations to have would be with their healthcare provider. I think that I believe that here too, the benefit of being vaccinated is likely far outweighs the risks. And clearly, if you're going to be vaccinated, no vaccine site, or certainly none at this time, is without, medical backup and an ability from, the health personnel that are at these sites to administer medications that permits, that will, reverse the allergic symptoms. So I think that, your history of hyperallergy or being, very allergic shouldn't sort of push you away from not at least seeking more information around it. It is far more important to get vaccinated than to not be.
Great. Thank you, Dr. Fairweather. Here's another question.
Just let me say that people that do have a history of allergy are watched for a longer period of time after the vaccine to make sure everything is okay. And the only absolute contraindication would be if you had an anaphylactic reaction to the current vaccine, to this vaccine or its components.
Great, thank you. So Dr. Brewer, while your mic is up, what is messenger RNA?
It's part of the genetic material, and in these vaccines, it works in the cytoplasm, and it causes an immune reaction so that you can react to COVID if it enters your body, right? To the spike protein. So it's part of the genetic material, and it's done synthetically in a lab for the vaccine.
Thank you. Here's another question. Good afternoon. Do you think it's safe for anyone who is bipolar to have the vaccine? Renee, you want to take that?
I believe that it is safe. I believe that you should be working with your healthcare provider, and because they already know what medications that you're taking already, and if there's anything that's going to be contraindicative. But other than that, I don't see any reason why you shouldn't. Your healthcare provider knows your medical history, and they should be able to guide you on taking the vaccine.
Great, thank you. And here is another question. Is there anything being done nationally or on a bigger scale to build the trust among Black people? We only reach in small portions of the Black population by speaking with our patients, who are already connected to care. What is being done at a national level?
Yeah, so there are several efforts that are already taking place at a national level to reach the Black community using different channels. So the NIH has a COVID vaccine prevention trials network where they have Black scientists, myself included and many others, who read all the protocols for each one of the vaccines and gave feedback on the vaccines and making sure that they recruited more Black patients so that we can gain more trust within the Black community, as well as gave them advice on how to do rollout for these vaccines and messaging within Black communities. CDC also is working on several projects where they are providing messages to media within the Black community to get out media messages around the vaccine, particularly talk radio, the Black community, and others. There are also efforts that are at place for the Department of Health and Human Services. Just a couple of months ago, they gave a $40 million grant to Morehouse College to really take a look at rollout of the vaccine, as well as monitoring COVID-19 rates in communities of color across the US. And what Morehouse has done is now they're working in concert with many community-based organizations, with many healthcare facilities all across the nation to monitor what's taking place in Black and Brown communities around COVID-19. But then also, more importantly, coming out with specific messaging for each one of these areas, and sometimes working with social influencers online for some of these specific areas to tell people where to go for vaccine, as well as to convey messages about how important it is to get vaccinated. So there is definitely an all-out national effort at multiple levels that's taking place right now to raise awareness around the vaccines.
Great. I'm so encouraged. So I have a follow-up question. Is there any evidence that the vaccine can make young Black men sterile?
The answer is no. It's an emphatic no. I think this is one of the many myths that are out there. The other concerns are, can it change your DNA? And the answer is no. Can it, make women infertile? The answer is no. Can it, it's some, kind of, tracking device that's being injected in people's bodies. No, please, those are not even conversations that need to, look, they're answers, they're questions that will be asked, but I think we need to be very clear about really the benefits here, and that this is information that's coming from very questionable sources and really is going to, will derail your efforts to stay healthy.
So we're at the 1 o'clock hour, and I do have one last question. What if I got the first dose of the vaccine and then I get the virus before the second dose? How long would you have to wait to get the second dose, or do you have to start over after quarantining?
You don't have to start all over from the vaccine. You can get your second dose once you're out of isolation, and it's safe for you to leave your isolation. You can get your second dose.
Okay, great, thank you. And there's one last interesting question. Do you know how the vaccine works for people who have multiple sclerosis?
I mean, if the question is whether it's effective, I wouldn't be able to speak, authoritatively about that. But I think that the way that it works and the expectation that it should keep, offer and provide protection is, I think, just the same as with, a person who doesn't have multiple sclerosis. So not the disease entity itself, I'm not aware should have anything really to do with the effectiveness or how it works. It should be just, as effective and certainly as important to have it if you have that particular health concern or health issue.
Great.
Well, thank you. Thank you all for your questions. And I want to thank all the presenters and all the sponsors. Thank you so much for everyone that joined today. To close out our program, we're sharing some videos of our African-American Vax champs, including myself, Elmhurst employees who share why they decided to get vaccinated for the COVID-19, as well as some photos of our staff. Elmhurst employees, please remember to join us on D4 after the program concludes for a special post-dialogue grab and go treats. Thank you, everyone.
My name is Dr. Phillip Fairweather. I am the Associate Director of the Adult Emergency Department. I worked at Elmhurst for 25 years. I am originally from Jamaica, the country, during the height of COVID. It is still almost difficult to put into words. It was very hard to see so many patients, so quickly, having so many of them dying without families at their bedside. There really is no, in fact, in my mind, no option. This is the only way to protect myself if you were to become infected, is that your body is able to fight this illness. And that is what a vaccine really gives us an opportunity to do. We wouldn't put ourselves on the line if we didn't think that this was the right path.
So thank you all again. Again, we want to thank you for this spirited conversation, and we're waiting for our next video, I believe. Again, Elmhurst employees can join us in David for post-program dialogue, for grab and go. There's all great information we've all received here. I hope you will take it back to your families, to your communities especially, and to let them know that Elmhurst is here for everyone, for all your healthcare needs, and the vaccine as well. Thank you.
My name is Rose Green. I'm the NYSNA, New York State Nurses Association Union representative here at Elmhurst Hospital, and I'm also the labor chair here, overseeing all the unions here. I've been at Elmhurst for the past 21 years and work in the emergency room for 17. I grew up in Brooklyn, New York, and also Queens, and I'm originally from Jamaica, West Indies. During the height of COVID, it was very frightening for me. The reason why I got the vaccine was it made me think about not only myself, but protecting myself and my family members, the people I work around. It's better than being sick or dying from the virus versus not taking it.
My name is George LeConte, administrator for Ancillary Services. I grew up in Laurelton, Queens. I'm originally from Port-au-Prince, Haiti. During the height of COVID, it was a scary experience. I got the vaccine for my family, for a number of people that, really sacrificed their lives for this. And it's important for you to get this vaccine so we can get rid of this disease once and for all. I think people should think about their loved ones. Even if you don't think about doing it for yourself, think about doing it for your loved one. You have to get the vaccine. I don't see any other option.
So again, I'd like to thank everyone that joined. I want to thank again our Queensborough President, Donovan Richards. Thank you again. Thank you again, Council Member Adrian Adams. Thank you, New York State Association Representative Judith Cutchin. Thank you, Roger Milner, Metro Plus Chief Growth Officer. Thank you to the wonderful panelists, Dr. Marlon Brewer, Dr. Phillip Fairweather, Mr. Gregorio Mellott. Thank you, especially for the information regarding the CDC and INH and things that they'll be doing to reach our community. And thank you, Renee Mills, for ensuring that we remember our patients or loved ones that suffer with mental illness. Thank you all for joining us today. Be safe and be well. And Elmhurst will always be here for you.